So today's lunch and learn about pelvic health. And I know my mom always said don't talk about pee and poop when we're eating, but I'm gonna break the rules today. So a little bit about me. I went to undergrad at the University of Iowa and then did physical therapy school at Des Moines University. And so pelvic health is an addition to the degree of physical therapy. So I took level 1, level 2, level 3, and it's in the process of getting my certification for all those levels. So with today's lunch and learn, I have some basic learning objectives that I said we're going to have a pop quiz at the end. So take notes. And I could probably do this lunch and learn on like very specific topics of just peds, just males, just females, but today's kind of just an overview of mainly adult females. So understanding the basics of pelvic health, and then describing the role of physical therapy in pelvic health, and then identifying evidence-based practices, applying the knowledge to real-life scenarios. I'm not going to read everything, but okay, so next I have a few videos, and you have to decide if it is normal or if it isn't. Oops. They all played at the same time. There we go. That's not normal. I would say not normal.
This must be man stuff. Because I'm not picking up a.
You don't power lift?
And I don't have anybody to pee on.
All right, so let's dive a little bit into the history. So this went all the way back to 1936. Margaret Morris was a physical therapist and also a ballet dancer. So she started kind of preaching about the importance of breath work with the pelvic floor, and then with that training to prevent leaks. That started in the UK. So then 1940s, 1950s, Dr. Arnold Kegel published his research paper, and he's the one that developed the Kegel or Kegel exercises that everyone's mostly familiar of. And he focused on women after childbirth. Then 1970s, 1980s, more holistic approach and more advanced imaging. They had like manual therapy, biofeedback, patient education, and then they also recognized that men would benefit too. Come 1990s, 2000s, increased research recognized that children could benefit, and that's also when the American Physical Therapy Association said it was a specialty of physical therapy. 2000s to now, more awareness and more education, especially through the internet. And so then comes the question, if pelvic health was recognized all the way in 1936, why is it often under-discussed? Mostly it's because of stigma, embarrassment, perception of normal. A lot of you laughed with some of that, and a lot of moms after childbirth laugh when they're jumping on the trampoline and like, oh, I just peed myself. And then other moms are like, yeah, I do that too, and then it is considered normal, even though it's not. And then lack of understanding the importance and function of the pelvic floor. So, what is pelvic health? So the definition is just proper functioning of the muscles, ligaments, connective tissue in the pelvic region. Very common, but again, not normal. So UI, urinary incontinence, and all of these have ranges of different research articles. But you can see it goes all the way to 83%. FI, fecal incontinence, constipation, pelvic pain, pelvic organ prolapse, and pregnancy pain. And so then on the right side, risk factors: age, pregnancy, obesity, chronic constipation, smoking, pelvic trauma, menopause, high impact exercise, radiation therapy, certain surgeries, and then more. So everything in red are the pelvic floor muscles. Then the true pelvic floor muscles are the ones I have arrows pointed to. So the yellow one is the pubococcygeus, blue iliococcygeus, and the red puborectalis. So you can see on here, vaginal opening. So this is a female, vaginal opening, and then everything else. So you can see when those muscles contract, they close off and maintain continence with fecal or urine. Another funny video for you. So I often say the pelvic floor muscles are like a hammock. I'm hoping your hammock supports you a little bit better than this one did. But just the function of the pelvic floor: support organs, bladder, uterus, rectum, if you still have your uterus, controls bladder and bowel movements, supports sexual health, and then maintains posture stability of the pelvis and spine. Because you can see everything is connected all the way up, and up top is your low back, or the lumbar. Alright, so populations that can benefit, you can see is pretty much everyone. Typically, kids, I treat 5 to 105, but like I have a 3-year-old in right now with me, so it really varies, but according to current medical understanding, there's no definitive age limit for who can benefit from pelvic floor physical therapy. Even older adults can experience significant improvement in pelvic function with proper exercises, making it beneficial for all ages. And this is why we have individualized plans for everyone. So according to a research study, this is absent of childbirth. They looked at 2 groups, less than 40 years old and older than 70. And no interventions were performed with this, but results were found that there was more room in the pelvic area in the older population, and that was due to decreasing resting muscle tone. But the pelvic floor muscle strength was similar between the both groups. So this just means older individuals can see benefit and improvement, but less significant or over longer periods of time than the younger adults. So that's kind of why I have the picture. There we go. So left is kind of the younger adult pelvic floor. You can see it's more taut, whereas the older adult, it slopes down a little bit more. And that's why you get more of that room or space in the vaginal vault. Alright, so in front of you, under the first page, is this cozying screening tool for pelvic floor dysfunction. We have it kind of in the bathrooms throughout the hospital too, and on the clinic doors on some of them. But you can fill this out, and this really looks at screens for incontinence, bladder and bowel, pain, urgency, frequency, and constipation. If you select or check 3 or more boxes, you likely have a pelvic floor dysfunction and would benefit from physical therapy. Alright, bear with me because this slide gets a little long, but common pelvic health conditions. Urinary incontinence is probably the most common, but there's different types. So there's stress urge mix, so both of those. And then I forgot to put functional, but there is a 4th. So stress, leaking with, coughing, sneezing, laughing, or exercise. Urge, that intense sudden that you cannot prolong to get to the bathroom, and that's usually along with leakage, trying to make your way to the bathroom. Mixed is both, and then functional is the inability to reach the toilet due to physical or cognitive barriers. With that, according to a study, pelvic floor muscle training and bladder training was shown to be as effective as oral medication in treatment of urinary incontinence, and that was a 4-year follow-up after 3 months of treatment. And that's not, I'm not saying don't take your medicine if you are on any, but we usually do like a combination of both, and we work hand in hand with doctors. Next is pelvic pain. So endometriosis is a condition where similar tissues to the uterine lining grow outside of the uterus. Dyspareunia is painful intercourse. Interstitial cystitis is that painful bladder syndrome. So chronic condition where the bladder causes pressure, pain, and sometimes pelvic pain. It is often mistaken for a UTI, but there's no infection with it. Vagissimus is vaginal muscle involuntary contraction during intercourse, inserting a tampon, or during gyne exams. And then prostatitis is inflammation of the prostate gland, and that's only in males. So then pregnancy-related pelvic dysfunction, everything changes when you're pregnant. So diastasis recti is the separation of the abdominal muscles, and that typically is common during the 3rd trimester once your belly is getting bigger. But it also can occur in infants, obese people, and heavy lifting or decreased muscle tone. Alright, pelvic organ prolapse, there's 3 types. Cystocele, fallen bladder, rectocele, fallen rectum, and then uterine, fallen uterus. So, according to a study, pelvic floor muscle training leads to the reduction in pelvic prolapse symptoms. So, this is more important in women and caregivers for preventative strategies, because once it's at a certain level, you can't reverse it. So if it's at a level 3, you can't get it back to a level 2, it's going to stay at a 3, but you can reduce symptoms. Once it kind of hits a level 4, that's mainly when it's not reversible, that's out of the vaginal vault, and we can't get it back up. That mostly likely would require surgery. So with the post-surgical recovery, prostatectomies for men, it was noted that 70% of men have difficulty controlling their bladder 6 months after the surgery. And then constipation. So dyssynergic defecation is the main mainly why physical therapists see people for constipation. And that is when the muscles do not coordinate properly. So when you're trying to bulge down or push out, fart, poop, whatever, you're actually contracting up and you're fighting yourself trying to push it out. So it can lead to partial or fully closing of the anus when you're trying to have a bowel movement, and then you have either constipation or incomplete emptying. Alright, so now the role of physical therapy in pelvic health. So we do a detailed evaluation of not just the pelvic floor, but like hips, abdominal, core, back, posture, and then of course the pelvic floor muscles to see everything what is going on. Because if you think you need a good structure to have your pelvic floor attached to. So if you have weak hips, weak glutes, whatever, that's going to affect your pelvic floor as well. So some treatments we do, this is not an extensive list, but pelvic floor muscle training, a lot of people think we just need to strengthen the pelvic floor. In every case, strengthen it. That's why they say do your Kegels or Kegels. And then you go on and that's it. But sometimes we actually have a problem relaxing the pelvic floor with urgency or constipation. So then you get incomplete emptying, and so then you go to the bathroom, didn't empty fully, so then your bladder fills a little bit and you have to go 30 minutes, an hour later, and that is more of a relaxation problem than strengthening. We can use biofeedback, and that's just using sensors or other types of modalities to help patients identify their pelvic floor. Manual therapy, soft tissue mobilization, either in the pelvic floor or outside abdominals, scar mobilizations if you have had any scar, cesarean scar, or like if you have your gallbladder removed, sometimes those can adhere down and affect your bladder function. Electrical E-stim, we use that for constipation, urgency, and strengthening. And then core strengthening and stability, improving your posture and alignment, and behavioral education. So sometimes it requires voiding schedules to retrain the bladder to allow it to fill properly, bladder and bowel retraining, and then nutrition and exercise. So these are just different types of biofeedback. So the middle one is typically what I use in clinic, and it's a computer system where I hook up the patient and then they can physically see what is their muscle doing. Are they doing their exercises properly? And then we train like how to do a proper Kegel. Other biofeedback is like a mirror therapy. You can do that at home to see if you're doing it correct, or on the left, she's just sitting on a towel to lift off the towel and feel that her muscle is actually lifting off of it and then relaxing back onto the towel. Alright, so benefits of physical therapy, physical and psychosocial. So physical, improved muscle strength and coordination, or relaxation, that's with the coordination. Reducing pain and discomfort, enhancing bladder and bowel control, and then psychosocial, improving confidence and quality of life. Because I think the main concern my patients typically have is quality of life. They can't leave their house as much, or they need to be close to a bathroom. They are looking for the nearest bathroom every time they go somewhere, or they go just in case before they leave all the time. So it really affects where they can go, how far they can leave their house, and all of that. And then better sexual health and intimacy. So now getting into the specific populations a little bit. So pregnancy and postpartum. This is typically where most people think of pelvic health. So this is kind of where I'm going to start. But if you think pregnancy, postpartum, you have a ton of hormonal and physical changes affecting your pelvic floor. So there's a lot of conditions during pregnancy or postpartum, like low back pain, SI joint pain, or like the pain right between your tailbones, sciatica, pelvic girdle pain, pain with intercourse, the separation of the abdominal muscles, or incontinence, either urine or bowel. So some of the treatment for that, we do pain control and pelvic alignment, perineal massage, and that's just to prep the vaginal tissues for stretching during childbirth. And I typically teach patients to do that at home around 36, 37 weeks to prepare them for childbirth, to help with some of the tearing. It doesn't prevent it totally. And then laboring positions, because you don't have to labor on your back. If you do get an epidural, you have to labor on your back or side. But if you don't, there's other positions you can labor in, depending on your doctor. Postpartum pelvic floor rehab, scar mobilizations, what I talked about earlier, trigger point release, education, strengthening, and stretching. So I say every postpartum woman should be seen by a pelvic floor therapist around the 6-week mark when they're cleared by their doctor. And you can bring your baby to the appointment. So if you have any grandchildren, children, let them know. We're here to help, especially if they're postpartum. So I came across, when I was making this, a blog post, and it was titled, Kegels, Trampolines, and Moms Who Leak. And this was by Deborah Goldman. So the blog discussed multiple women after having kids will pee themselves if they jump on trampolines or go to boot camp classes. She quotes, "The surprising thing to me is that so many women shrug off the leaking and laugh with each other about it. They mention that they know about Kegels and would help, but they just haven't made the commitment to follow through. I think the bigger problem is perhaps that the pelvic floor muscles have gotten so weak that when they try to do a Kegel, it's hard for them to identify, feel it, and there is not enough feedback to give them motivation. If you can't feel or identify your muscle, it will be very difficult to strengthen enough to stop the leakage." So then after I read that, I did my own little research and I asked 16 numbers of moms ranging from 12 weeks to 3 years postpartum, and if they would feel comfortable jumping on the trampoline without leaking. And 63% stated they would not feel comfortable jumping on a trampoline without leaking. And so, why physical therapy is so important in the postpartum population? Long story short, to reduce or eliminate pelvic floor dysfunction symptoms, and then prevent a long-term sequela that affects their quality of life down the road. So then the neurological population, these are just some examples of the neurological population, but we can help with, these are kind of a little more challenging cases because this is more adaptive ways to help because we can't prevent or stop what their diagnosis is. So we can help with bowel and bladder routines, toileting setup, positional strategies, fall risk assessment, and education and training for caregivers. All right, then athletes. So you saw one of the athletes in the first video with the power lifter, but prevalence kind of ranges again with the specific sport at hand. So 14 to 80% with pelvic floor dysfunction. The more higher prevalence are with trampoline, gymnasts, heavy lifting or powerlifting, high impact running, and then volleyball, basketball, soccer, those like change in movement sports. Moderate to lower, tennis, dance, and then the lower or more cycling, yoga, and Pilates. But cyclists might have more pelvic pain, especially in the saddle region, from their bike seat. So symptoms, I typically say use the Cozine screening tool, what's in front of you, to screen for that incontinence, pelvic pain, sensation of heaviness or bulging, or that prolapse, urinary or fecal urgency, and constipation. So, also some athletes I hear get like nervous pees or poops before games, and that can be due to the underactivity or overactivity of the pelvic floor muscles, or anxiety can trigger. So when they get anxious, the body goes into like that fight or flight mode, and that can cause the muscles to tighten up, which sends a signal to the bladder and the brain and causes a false sense of urgency, even though their bladder is not full. That doesn't just apply to athletes, that can apply to anyone in real life. If you get in that stressful situation and your pelvic floor muscles tighten up, causing that false sense of urgency that you need to go to the bathroom. Short-term and long-term effects, not just for athletes, can lead to progressive symptoms like incontinence, prolapse, decreased quality of life due to pain, social isolation, what I talked about earlier, psychological distress, and increased healthcare costs from chronic issues. So then on to peds. Common issues are with urinary incontinence, constipation or fecal incontinence, pelvic pain, difficulty with toilet training, and post-surgical rehab. And then you can see the prevalence, a little pretty high, especially for constipation and pelvic pain. And pelvic pain, a painful period is the most common for pelvic pain in adolescents. So according to a study, 76% of kids who received pelvic PT had improvement with constipation symptoms compared to 25% who showed improvement on laxatives and stool softeners. Additionally, kids who received pelvic PT had fewer hospitalizations for cleanouts compared to the control group, and the kids that had the highest response rate suffered from anxiety or low muscle tone. And again, I'm not saying never to use laxatives or stool softeners. We work hand in hand with the physicians, and typically, or sometimes we encourage both medication and pelvic floor therapies. Alright, so still on the pediatric population, benefits can improve bladder bowel control, pain reduction, and better self-esteem, and improved quality of life. Especially with those kiddos of bedwetting. I hear a lot of them preventing sleepovers with friends because they're afraid they're gonna wet the bed at night. So then some treatments, a lot of it is play therapy, because with kids you can't just not have fun. But using play therapy for education, treatment, and then that gets them to participate. So just today I had a kiddo and we used Play-Doh to describe what poop she was having. So I had her roll out and see, was it a little turd, was it a long snake? And that's how I learned from her. Pelvic floor muscle training to strengthen or relax the pelvic floor, biofeedback, different techniques, kind of what I talked about earlier, postural training, and bowel bladder training. Alright, so on your handout as well you have these numbers, but these are adult norms for bowel and bladder health. So for bowels, 3 times a day to 3 times a week is considered normal. If you have less than 3 times a week, it may be normal if that's your usual and it doesn't cause you pain or discomfort. And I have a chart on the next slide for soft formed and easy to pass. Brown should be the color, and no straining, pain, or complete emptying. So I don't want you holding your breath when you're trying to poop and having your face turn really red, kind of like the kiddo on the first screen. And then for bladder, your bladder can normal adult bladder can typically hold up to 2 cups of urine. Urinating 6 to 8 times per day, that's typically around 3 to 4 hours. Getting up 2 times a night is considered normal, especially for the older adult. We would like 1 time a night or less, but 2 is still considered normal. Not rushing or straining when urinating. Sitting to urinate when possible. So sometimes we squat to urinate when we don't want our butt to hit the toilet, but that also, when you're in that squat position, your pelvic floor muscles are contracted, not able to relax fully. So if you're worried about germs, put toilet paper down, but your skin is a great barrier for those germs. And then I even encourage some men or boys to sit when they urinate instead of stand. Avoid just in case peeing, because that can lead to the urgency or frequency, because because it doesn't allow your bladder to fill, and then it sends a false signal to your brain. Females, white front to back. Stop drinking 2 to 3 hours before bed. Knowing constipation can affect your bladder health, and then stay hydrated. Half your body weight in pounds, and then divide that by 2. That should be how much water you're consuming in ounces a day. Watch your bladder or your urine color. It should be a light yellow. Alright, so here's my poop chart. And typically we want between a 3 and a 4. So that's kind of what I was talking about with the snake-like. Alright. So these are 3 of the cases that I've had. They're all completely different patients, so we did all completely different treatment options for them. But the first one was a 44-year-old woman with stress, incontinence, and pelvic pain. So the outcome overall, she rated 99% improvements in 8 weeks of therapy. Case 2 was an 82-year-old woman with pain with intercourse, mixed incontinence, urgency, and constipation. And after 5 months, she had no pain, no leaks, rare urgency, and regular bowel movements. And then case 3 had a 4-year-old kid with difficulty potty training during the day, and we tracked it by number of pants changes during the day. And so she started at 8 to 10 pairs of pants per day. You can see that's a lot of laundry for the mom to do, but we got it down to 2 to 3 in 6 weeks. Alright, so common myths of pelvic floor physical therapy. So it's normal to leak when jumping or sneezing. It's common but not normal. Urinate just in case or every time before you leave. And as mentioned earlier, doing this can train your bladder to signal urgency before your bladder's full. So over time, this may lead to an increase in frequency, urgency, and even urge incontinence. 3, men don't have pelvic floor muscles. That is false, everyone does. Always invasive or uncomfortable. Internal exams may be a part of the treatment, but they do not have to be. That is your choice. They are only done with full consent. Pelvic PTs are specially trained professionals who create a safe, respectful, and judgment-free environment. Issues will resolve on their own. I hear this a lot, especially with kids that are bedwetting or postpartum moms, my sister included. While some mild postpartum symptoms may improve as the body heals, often untreated pelvic floor issues persist and can worsen over time and with subsequent pregnancies. I talked about like spending the night at a friend's house, and I just say like, why hold your child back when there is something you can do to prevent that and allow them to go spend the night. Pelvic floor therapy is just Kegels, and it's both Kegels and Kegels. You can pronounce it both ways. It's Dr. Arnold Kegel, but I hear a lot of people say Kegels. Doesn't matter. I'll know what you're talking about. They are not a one-size-fits-all solutions for pelvic floor dysfunction. In some cases, they work. Some cases, they worsen symptoms, or can be counterproductive. And if you're doing them incorrectly, it's not going to help anything. You need to know you're doing them correctly. It can be painful. Again, healthy muscles should not be painful to the touch. You should only feel light pressure during the exam. You may be coming in due to pain, and if that's the case, inform your therapist, and we can address different strategies. And then pelvic floor therapy has been a proven solution for certain pelvic health issues. All right, so I have some common questions here. And at the end, if you have more questions or have more personal questions, I'll stick around to answer individual questions if you don't want to say it in front of the group. But common questions here: what can I expect from the first visit? Usually the first visit, we try to gather a ton of information and establish a plan. So I'll ask a lot of questions about posture, strength, muscle tension, breathing, and other physical assessments can be performed at a time. Usually we do an hour session for the first one and then 45 minutes to follow. During the initial exam, we also want to establish goals for you based on what you're hoping to achieve with therapy. I hear this a lot. Do I have to have an internal exam? No, or at no point is the internal exam required, but it is an option for treatment. So internal exams use a single finger, not a speculum or other tool, to assess the resting tone, sensitivity, coordination, strength within the pelvic floor. It can be very helpful for both assessing and treating the pelvic floor, but is never expected or required. We get consent each time, each visit. If you change your mind one visit to the other, totally fine. We have many patients who are comfortable with this and want to perform the internal exam with their sessions, but we also have patients who are not interested and we treat a different way. Either way, we work with you, whichever way you're comfortable, to help you reach your goals. Again, what if you change your mind during the treatment? It is always you are in control during the session. If you at any point change your mind about a form of treatment or assessment, let us know and we'll change our route. We always try to get a good read on patients' comfort to avoid any triggered treatments or activities, but we want all patients to know they can stop a treatment at any point in our sessions. We will respect any decision you come to and always want you to feel comfortable and confident. Do you need a referral? So for this facility, if you're an established patient, you have a primary care provider at the Sibley Clinic within 2 years, we are direct access. You can come to us and we'll get an order from your doctor. Otherwise, you'll need a referral from your doctor, so you'll have to schedule an appointment with them and then get the referral here. Will insurance cover pelvic floor physical therapy? It is considered a physical therapy service, so it depends on your insurance plan, but most insurance says yes. You get this question a lot. How long does it take to see results? And my answer is it depends. Every patient is different. So generally we say 4 to 6 weeks to increase brain and muscle coordination, and then 4 to 6 months to see muscle changes. Typically with pelvic floor therapy, I do once a week to start out, and then we gradually do more check-ins and go once a month once you have an established home exercise program. And then you get out what you put into it. All right, so key takeaways. Pelvic floor function, this is your pop quiz. Pelvic floor function supports organs, controls bladder and bowel movements, supports sexual health, and provides posture stability to the pelvis and spine. Everyone can benefit who has symptoms. Don't ignore your symptoms because it can lead to progressive symptoms like incontinence, prolapse, decreased quality of life due to pain, social isolation, psychological distress, and increased healthcare costs, and it can improve your quality of life by seeking help. Any questions?
Are there exercises you should do to keep your pelvic healthy?
Yeah, so kind of with what I talked about with the Kegels, but again, it depends on your symptoms if those are going to be beneficial or not.
Where do you work out of? Like the therapy center has just curtains.
Yes, so in that's illegal to just have curtains, so I am in the back treatment room, full walls with a door that shuts. And then I have an extra curtain over the door, so we're double protected.
And it locks, the door locks.
And the door locks.
What do you have to do to sign up?
So if you are an established patient at the clinic within 2 years, you can just go to the front wellness center area and it is direct access. Otherwise, if you are not, you'll need a doctor's appointment to get a referral. Anything else?
Thank you.
Before you guys all go, our next Lunch and Learn is November 6th. The topic will be scams and fraud, presented by Bryce Baker at Silly State Bank. It will be here, so if you would like to attend that, please sign your name on the little slip and we'll get you signed up. Thank you, guys.
November 6th.
Oh, also, in front of you, there is a fall prevention and balance class that we're gonna have. It has free screening, so you guys will, everybody who attends will be getting an assessment by our physical therapist here, and it's free, and it starts at 3 o'clock. Light refreshments will be provided. And it's limited to 25 people, so if you would like to sign up, please call or go to the website and sign up. That should do it, but we hope to see you guys there.